This week we're going to be covering drug and complementary therapies. Integrative and complementary therapies. Since you've already done the reading, these terms should be familiar to you now. The climate for complementary therapies is changing. The NCCAM, or the National Center for Complementary and Alternative Medicines, reports that over 38% of adults use some type of complementary medicine in their treatment. More healthcare professionals also choose complementary medicine for treatment than the average population. Terms that will be helpful for you this lecture. We have integrative. This method blends conventional and non-conventional therapies. Alternative, where one therapy is used instead of the other. And then complementary. This is where one therapy is used alongside traditional medicine. It complements it. Examples of alternative medicine. This would be Ayurveda, which is originating in India over 5,000 years ago. Some say it's original holistic form of medicine. Then there's the traditional Chinese medicine like acupuncture. And also we have homeopathy and naturopathy, where homeopathic methods treat with natural substances and naturopathic means is to treat with diet and exercise or massage. Please take some time to watch this video on Dr. Terry Wales to see how complementary therapies are used in modern treatments. Dr. Terry Wales is associated with the University of Iowa. Additional therapies referred to as alternative medicines include bioengineeric therapies, diet and nutrition, herbal, manual healing like chiropractic care, and mind-body medicine. Where you tend to see alternative or complementary medicines takes a forefront in this is pain management. Pain clinics tend to be outpatient and focus generally on specific pain issues, like back clinics. Some are broader and are considered multidisciplinary pain clinics. Again, outpatient status usually, though it wouldn't be unheard of to see a few inpatients. Centers such as these provide rehabilitation, medical, psychological, and educational services. The difference between multidisciplinary pain clinics and a center is that a center is usually found in some type of medical school or training hospital, and the care they provide can be a complex model of managing and treating pain as well as engaging in research. Pain is different to many people, and it's a broad range. At times it can be difficult to pinpoint, like asking someone what their favorite movie is. It's impossible to say. There's so many genres: comedy, thriller, drama. Same goes for pain. Pain is defined as the hurting or strong discomfort in some part of the body caused by injury, disease, or disorder, transmitted through the nervous system. Basically said, pain is what a person says it is, existing when it does. It's different to everybody. In the medical field, pain is usually put into two categories: acute, which has a sudden onset and lasts just hours to days. Acute pain is usually the body giving you a warning that something is wrong, as opposed to chronic pain, which that occurs over long periods of time. It can be neuropathic, meaning it comes from the nervous system, or nociceptive, comes from the tissue. Back pain that plagues several Americans is typically seen as a chronic neuropathic pain. Here are some other terms that will be associated with pain. There's an angina. That is the disruption of blood supply to the heart, causing tightness or burning pain in the chest. There's breakthrough pain. This is caused by the reoccurrence of chronic pain. And then malignant pain is pain that is caused by cancer or the treatment for cancer. Phantom limb pain comes from the amputated body part, and psychogenic pain is experienced by patients with psychological disorders. As I mentioned before, pain is different to everyone. It comes with several variables, some of which are listed here. Early experiences of pain, cultural backgrounds can have an effect on tolerance or pain experiences. Anxiety and depression play their roles, as does age and sex. Think of pain as a gate. The gate control theory of pain is that pain needs to be a balance of information traveling into the spinal cord between the large and small nerve fibers. If there is no pain stimulation, then there is no transmission to the brain. If there was pain stimulation to small nerve fibers, that transmission gate is then open to the brain and pain is then felt. Treating pain starts with pain assessment. P is for the place where the pain is happening, A for the amount, I for interactions, and N for neutralizers. So let's use a headache to assess our pain. The place is the head. The amount, using a scale from 0 through 10, let's say it's at a 3. The pain intensifies when the patient interacts with light. Darkness and rest neutralizes the pain. By assessing the pain, the doctor could now help treat the patient better, and maybe they are suffering from migraines. Some forms of treating pain patients can handle on their own at home with non-prescription drugs, or OTC, over the counter. Acetaminophen, more popularly known as Tylenol, and then there's NSAIDs, or non-steroidal anti-inflammatory drugs. These include salicylates like ibuprofen, aspirin, and naproxen. If OTCs aren't cutting it, doctors can prescribe other drug therapies like muscle relaxants, anti-anxiety and antidepressant medications, prescription NSAIDs, steroids, epidural steroid injections, and then opioids. In some cases, PCA pumps or pain pumps can be set up. This is a pump that goes with the patient, and it allows the patient to decide when to administer their own pain medication. Along the same lines, intrathecal drug therapy is a pump that is surgically placed under the skin that delivers the medication into the intrathecal space, hence the name, which is located around the spinal cord. We aren't the doctors here though, so you might be asking, what are your role at laboratories on drug therapy and pain treatment? Labs here monitor therapeutic drug dosing and programs. This provides information to the clinicians to establish optimal therapeutic drug levels for individual patients. Here are some key terms: peak and trough. A peak is used to describe a drug's maximum concentration in a patient's plasma or blood. It is usually achieved soon after a dose is given. Think of it as your mountain peak. The trough drug concentration is then considered the minimum drug concentration in the plasma or blood measured before the next dose is given. This is like the valley between the mountains. We don't want to get to a zero concentration though, because that means that there's no drug circulating in the patient, and so the patient would then be in pain. When you have a cold, the cough syrup bottle says to take every 4 to 6 hours. That dosing was determined using average drug metabolism in a patient and the peak and trough drug concentration. The therapeutic range is the relationship between the desired clinical effects of a drug and its concentration in the plasma. The therapeutic window is the range between the minimum effective therapeutic concentrations of a dose and a minimum toxic concentration of a dose. When a drug is determined to be toxic, this means that it is poisonous to the body. This would occur when the plasma concentration of a drug is higher than what the body can tolerate. Clearly, we want to steer away from this dosing range. Other treatments in pain can be via surgery. A neurotomy. Key medical term here is otomy, meaning cut into, and neuro, meaning nerve. So a neurotomy would be the dissection or division of an affected pain-causing nerve, thus closing the pain gate. A placebo is another form of treating pain. They are medications that produce an effect because the patient believes it is to be working, not due to its necessarily chemical or physical properties. In other words, it's mind over matter with a placebo. Along with medication and surgery, there are complementary therapies that are also used in pain management. Remembering from our week 1 lecture, complementary treatments can be used in conjunction in traditional medicine to achieve pain treatment. This could include biofeedback, relaxation methods like meditating, imagery, hypnosis, massage, and TENS units, which is a transcutaneous electrical nerve stimulation. All right, last slide. Additional complementary therapies used can be humor, laughter, like Dr. Patch Adams. There is a beautiful movie portraying this man's life and journey. I highly recommend it. Music can also help. They find that music is therapeutic in those with suffering from dementia and Alzheimer's. There's acupuncture, aromatherapy, therapeutic touch, Reiki, along with yoga and Tai Chi. When it comes to complementary pain treatment, it's only weird if it doesn't work. Well, this is the end of our lecture this week. There has been a new link added on Talon for potentially using on your response posts if you would like. Continue to work on proper citations. Those who need work, check the feedback and edit as needed. There's also a quiz due this week. Remember to use your objectives to help you study for such events and for your exams. As always, reach out if you have any questions.